So the appointment with Dr. Vaughn I had on 11/12. They did an array of tests, and I am sitting there with Dr. Vaughn, and he's going through a PowerPoint. Like I said previously, I had not had sleep for days, so retaining that information was pretty much non-existent. But the gist of the PowerPoint presentation was the fact that when you get COVID, it causes spikes in a protein that then causes your body to develop what's called a microclot. These are not the same clots that you get when you have like a DVT. These are very small clots, and what happens is they develop throughout your entire body, which is why most long COVID patients have similar symptoms, and the symptoms are actually from the microclots. There is a test that Dr. Vaughn is using, and what he does is they take blood from long COVID patients and they look at it in a microscope. And before they look at it, they actually separate the plasma from the cells. And when they're looking at the cells, they actually add a type of fluorescence. And what that does is that it makes the microclots visible under the microscope. And they have a grade that they're using, 1, 2, 3, and 4. The worst is obviously 4. It's widespread clots. 3 is moderate, and then obviously so forth and so on. So when they looked at my blood underneath the microscope, they found that I was a 3.5, I believe, if memory serves me correctly, but I wouldn't really count on that right now. So I was a 3, and I had a moderate amount of clotting, which is why they did put me on the triple anticoagulant therapy, which is the treatment for the microclotting. But a lot of us patients also have mast cell activation disorder because of the microclots irritating our epithelium, which then causes your histamine cells to dump, or your mast cells to dump a significant amount of histamine in your body. So there is an issue with that as well in our long COVID population. And then a lot of us also have compression of our iliac veins, which is why they get a CT scan. So all of those things together are basically causing our symptoms. And I'm going to go into more detail about those because I actually am going to be having surgery for my compression of the iliac vein. And we'll talk about the rest next time.